Welcome to InfoSource, a presentation of Berkshire Healthcare Systems, a not-for-profit system of post-acute healthcare services, including long-term care, short-term rehabilitation, independent living, assisted living, memory care programs, and hospice services available to our neighbors and families here in the Berkshires and beyond. I'm your host, Rachel Colasino, and my guests for today's show are Debbie Richardson, Vice President of Talent Management for Berkshire Healthcare, and Teresa Moreau and Rocco Coviello, two winners of Berkshire Healthcare's prestigious award, Profiles in Care. Welcome.
Thank you.
Thanks for being here.
Thank you.
So today we're going to discuss Profiles in Care Awards program, which is a very special way that Berkshire Healthcare recognizes our staff. And the award ceremony for the 2013 award winners was just a few weeks ago. So I'm joined here with two award winners, Teresa and Rocco. Rocco, you're a clinical liaison, and Teresa, you're a CNA at Mount Greylock Extended Care here in Pittsfield. Mm-hmm. And I'm also joined by Debbie Richardson, Vice President of Talent Management, and you oversee the Profiles in Care process. So, Debbie, I want to start with you. Can you give us a description of the Profiles in Care program?
Sure. We have a wonderful program that is aimed at recognizing our outstanding employees like Teresa and Rocco, who exemplify our core values every day, and as well as recognize those staff who really have made an impact in the quality of care or the quality of services of our residents, and or maybe have enhanced the employee relations or teamwork at the affiliates or across the organization. And this year we recognized 42 members of our organization as Profile in Care winners across all of the entire organization, and we actually celebrated, like you said, a few weeks ago at an elaborate ceremony that we had in Springfield, at the Marriott in Springfield. It was a great night.
Great. And I know the selection process is rigorous, and we'll talk about that a little bit later, but I just want to go to how Profiles in Care started and what was the thinking behind it?
Well, it started 7 years ago. My predecessor, Tersh Bragdon, had developed this idea about recognizing the staff and how important recognition is, to really help cultivate a culture of engagement, as well as develop better relationships. And she really started the program, and it's developed from there, and it has actually grown from there.
Okay. So, Rocco, how did you find out that you had won the award?
I was at one of our quarterly liaison meetings, and Lisa, my boss, Lisa Gaudette, was making the announcement and letting me know that I'd been nominated and that I had won. She read the nomination, and to our team, we have a collective team of about 12 other liaisons, and so it was at kind of our quarterly meeting I found out.
And Teresa, how did you find out that you had won the award?
I came into work and Dina, the human resources lady, said, I have a letter for you, and she read it to me. And then a couple weeks later, the DON administrator came to my unit, and they said, could we have everybody's attention? And they were talking about the award, and they said, we have a winner here, and they said it was me. I was shocked.
And Teresa, you've been a CNA for 40 years, which
Mm-hmm.
is tremendously impressive. I understand that when you first found out that you'd been nominated, you wanted to go out to the car to get your glasses.
Oh yeah, I didn't have my glasses with me, so I couldn't read the letter.
So she had to read it to you?
Yeah, she read it to me, yeah.
Okay, and Rocco, what were you nominated for specifically?
I think that one of the main reasons, I was nominated through one of our affiliates, Pilgrim Rehab in Peabody, one of our skilled nursing facilities. And it's the first time that someone from outside one of the buildings, I think from our team, our business development team, has been nominated. I think it's because of my collaboration with my colleagues in the building. I think that over the years, the 9 years I've been with the company and as a liaison, I've built some really good relationships with people in the building, and the new ones that I've forged have been, very productive. They kind of represent the idea of teamwork, and they noticed it, and they reached out into someone who wasn't really directly working in the building and nominated me.
Yeah, I don't want to make light of that. So you were nominated by people that you work with every day, but you're not necessarily working in the same building as them. It's a building that you support. And I think that's really important that, like you said, it's somebody who doesn't have face-to-face contact with you every day, but recognized your contributions enough to make that nomination. And in fact, you found out that you'd been nominated from someone at Pilgrim Rehab, is that right?
Well, Tara Gibney, who's the administrator, she had called me in the office, and she says, I got something for you. And I was like, okay, because I thought it was, I didn't know what it would be. And then she started reading, and she read this letter of nomination, and that had been put together by several of the employees at Pilgrim. It was quite flattering. I was very excited, and I was really touched at the thought that people in the building thought enough of me to reach out and to do that. It was exciting, and I think it was really exciting for our team too.
Yeah. So I read that story, and there's one piece of it that sticks out for me. So tell me about the rest stop and the computer access.
Yes. Throughout as communications get more complicated, more computer oriented, a lot more of our information gets passed, via communications on the computer. And a new system had been put in place at one of our, major referral sources, but it was not working very well with our own system. And consequently, a new referral was coming in. It would have been a good patient who really wanted to come to Pilgrim, but we had no way of accessing the computer system to acknowledge that to the case manager. And we were actually all heading down to a quarterly meeting, I believe it was in Sturbridge or in Hopkinton. And I got a kind of a frantic phone call from the director of admissions, Julie, saying that she couldn't get online, and that she's going to be so upset if we lose this patient. And I just told her, I said, don't worry, we'll figure it out. And as I was going down the Mass Pike, I pulled into a rest stop area, and I just figured that there's got to be some businessman or somebody using a laptop. And I walked in, and I saw this guy who was just reading the Globe online, and I approached him, told him who I was, gave him my business card, and explained to him what I needed to do, and he was very kind and generous, and he let me, borrow his laptop. I signed into the network. I answered 2 or 3, quick responses, thanked him very much, drove on our way, and, let people know that, that the referral had been responded to, the patient would be admitting, and it was good. It was very successful.
So what did your colleagues at Pilgrim say when they found out what you had done?
Well, I think they kind of know that I'm kind of creative.
Yep.
At trying to get the work done, and I think that they were just thrilled to think that thinking outside the box to make it happen.
Great.
Yeah.
Great. Thanks, Rocco. And Teresa, what were you nominated for?
Care of the residents, and my knowledge. I've been doing this for 40 years, and I've come up with some good ideas for the residents and make it easier on our better on our floor, and better for the patients, and teamwork.
And one of those ideas was the nurses station having televisions. Can you tell us about that?
Yeah, I work 3 to 11, and our residents are sitting at the desks waiting to go to bed until we can, get to them. And they're staring at the desks. And I said, well, don't you think that we should get TVs with DVD players? And now they watch a movie every night, and they love it.
So they actually have something to watch.
Oh, they have a lot of movies. We're always bringing movies in. And one of our residents, actually, she knows how to run the DVD player better than I do. So a couple times the patients wanted a different one in, so I had to call her over, and she fixed it for me.
Yeah, I remember. I
Little
came
Tara,
to see you,
little Tara.
and
She's
I saw
yeah.
her do that. That's great.
Yeah.
And Teresa, after you found out you had won the award, did you tell your residents right away?
Actually, I told, one of them was sitting at the desk area when they announced it. And so after that, she calls me over and she says, congratulations, and she gave me a hug. So she heard the whole thing. And one of my residents had been questioned by the administrator about me. And she said, don't worry, it's not bad. And so I told her I won it, and she was really happy. So, I mean, I couldn't believe it. It's like I was, in shock, and I was excited about it. So, and, I always talk to my residents about different things. So, and they were happy.
They should be.
Yeah.
40 years is a long
Yeah.
time. And so, Debbie, you and I both sit on the committee to choose these award winners, so I know it's rigorous, but can you tell us, walk us through the process of what that looks like?
Sure. Like I said, there is a committee that you and I are both part of, and it's probably the toughest part because there's so many great stories that we read about and hear about. And we look at these nominations on a quarterly basis. They're sent in, and there's a group of us that review them, and we look at the examples of really what our core values look like in action, and how it's impacted either the quality of care or the employee relations or the teamwork at the affiliate, and really look at how they're demonstrating our core values of integrity, compassion, excellence, and stewardship. And we get lots of nominations, as you know, about great things that people are doing, but it's those extra special ones that we see people going above and beyond that deserve the recognition.
Yeah, and I just want to underscore that point too, which is we get a lot of nominations of people who do their jobs really, really well, but it's people like you, Rocco, and Teresa who go above and beyond that those are the nominations that stick out for us. So Debbie, we've heard a little bit from Rocco and Teresa about what happens when they're nominated, but what is the process for all award winners when they find out first that they're nominated and then that they've won the award?
What that looks like is they first receive a letter, like they both mentioned, that they were nominated. And then after that, a few weeks go by and everybody receives a box of chocolates, and the award winners get their letters. You remember your chocolates? Aren't they beautiful?
They're
still in the freezer? Yeah.
Shared them with my coworkers.
So they all have, everybody gets those, and they receive the letter, and also inviting them to the Profile and Care event, which usually takes place the following year. And they also receive a $200 gift card at the time of the ceremony as well, and they receive a beautiful engraved clock at the time too.
Great. So we're going to watch some footage from this past year's award ceremony, and then we're going to come back and we're going to talk about that special night. So we will be right back.
Tonight we're celebrating the outstanding achievements of our staff and affiliates across Berkshire Healthcare who have distinguished themselves as role models of our core values and leaders in pursuit of our vision.
What really is important is what you people do. What you people do, you are the people at the bedside. You're the people who work with the people. We are all here to serve and to help. So I really want to say from the Board of Trustees, thank you so much for what you do with so much caring and so much kindness. Congratulations.
I really wanted to be here tonight with all of you because like you, I want to give back to Berkshire Healthcare Systems. They've given me so much, and they're an organization that continues to inspire and to challenge me every day. And to know that such a large company cared so much about their people, about their staff and their patients, that they were willing to acknowledge us and appreciate us this way. It's very special. The Profiles and Care Award has given me an even greater sense of humility. I felt the kindness and generosity from other people, but this time it was for me. Tonight it is for you.
We'll get to meet each of them and come to know them as colleagues who are aligned with our vision for excellence, while role modeling behavior that has significantly changed the way this organization delivers on its commitment to high-quality service and outcomes.
Andrea Black. Families always send Andrea thank you notes, sharing what her compassion meant to them. Andrea Black was amazing, said one family member. People like us are lucky that people like you make this journey easier to travel, said another. As a hospice care nurse, Andrea wears many hats. Most of all, she becomes a close family friend. Andrea exemplifies our core values, and we are a better organization with her representation in the communities we serve, says her nominating colleague. She has been called a guardian angel for her compassionate nature, her commitment to excellence, and the integrity with which she approaches every new challenge. Another patient's daughter put it the best when she said, "From the first day we met, you carefully listened to Mom's wishes. You left her in charge, a role she always held right where she wanted to be. Please help me honor Andrea. Festus Banja. Festus is the student who quickly became the teacher. As a nurse at East Longmeadow, Festus is a thoughtful leader. His nominating colleague says, Festus has grown to become one of our strongest nurses. He's one of our main preceptors and a true mentor to all his peers. When he first started, Festus took it upon himself to learn everything he could. Originally from Sierra Leone, Africa, he spent extra time with the staff development department working on lists of English words that gave him difficulty. Today, he's one of the most influential communicators at East Longmeadow. Festus is a key example of teamwork and how it works. His peers will even call to ask if he is on the schedule. Festus is so passionate about the core value that he asked to be part of the hiring process and help find nurses who exemplify them. During one Department of Health survey, the surveyor watched Festus perform a dressing change and said to the nursing team, "You should have him teach others. It was perfect. Never lose him. Please help me honor Festus." Mary Ellen Palmer. Mary Ellen always has the answer, and it's not just because she's the receptionist. As the center of everything at Pine Hill Assisted Living at Kimball Farms, Mary Ellen wears many hats. She is the Jill of all trades, arranging appointments for residents while scheduling staff, balancing budgets, and even visiting residents, working as an honorary member of the maintenance team. She demonstrates compassion no matter what the request, because she knows how valuable her time is to the residents and families who need her devoted attention. A colleague said, "The reception desk is our command center, and it's imperative that the person in charge demonstrates our core value. There's no better person for that role than Mary Ellen. Please help me honor Mary Ellen." We admire each of you for bringing our mission and vision to life every day. It's your commitment to excellence and stewardship, your compassion and integrity, your dedication to teamwork that are the core values that will lead this organization to collective excellence in the areas of clinical and service quality, workforce development, and fiscal health.
They represent the thousands of people who make a difference every day at each of our affiliates. They are Berkshire Healthcare, and we are proud to honor them here tonight.
Welcome back. So we just saw footage from this year's award ceremony, and so I'd like to talk specifically about that. Debbie, this is a huge event to plan, so can you tell us about the planning that goes into the ceremony?
It is huge, and my assistant would say it's like planning a wedding.
Yes.
She plays a crucial part in that. We really start the day after the event ends and look for a place to try to secure the location where we can fit about 300 people. And a lot of work goes into it between, the writing of the nominations, writing of the speeches, putting together the pictures, the slideshows. It's a big task.
And Teresa, what was that night like for you, the award ceremony?
It was great. My oldest daughter, Christina, that I live with, and my sister came from Connecticut, and they were very happy. My daughter was proud that I got it, so I was happy to have her there. And everything was great. The food, the people, the awards, everything was just great. And it was so great that the nursing home, recognizes their employees.
Absolutely.
Like that.
Rocco, what was the night like for you?
It was a great celebration. It was. I love my relationships with people in the other parts of the company, in the building, and the home office. So to be there and having heard about Profiles in Care and the celebration every year, I've often wondered what it was like, and to be nominated and to win and to be able to go and represent my team with Lisa Gaudette there and Tara Gordon, my immediate supervisor, and to represent my colleagues. It was really wonderful to be there, and then to be able to meet Teresa and see Deb there and yourself. It's a great celebration. It's a very proud moment.
Great. I understand you and Teresa met at the bar for the first time.
Yeah, we did. We did. Yeah. But it wasn't like you think.
I know. Debbie, can you walk us through the evening and the celebration?
Sure. It's we want to make it as special as possible, and it starts off with really a chance to mingle, a reception in the beginning, and folks that can mingle, like Rocco said, you mingle with your colleagues, but also the people from the board of directors is there, the executive team, the affiliate leaders. And they're there not only they're there with their families. They bring, like Teresa brought her family members. They can bring whoever they want, and they have a chance to meet their supervisors, their colleagues, their coworkers, which is kind of neat. And then we head into the large ballroom for dinner, and right after dinner, Bill Jones, our president, says a few words, has a few remarks. So doesn't the board president, gets up and says a few words. And then I have the best job of all. I get to get up and introduce all these winners and tell a story about them and how they have impacted the quality of life and care of our residents and services that we provide. And while they're coming up to the stage to receive their awards, there's actually a slideshow going on behind the stage of pictures of them in action and really showing them doing what they do best, which is fun. And then they come up and receive their award. They shake their hands with their director or the president, and they walk off the stage and hopefully hang on to their awards. Unlike Teresa, who startled me when she was leaving. I think she just needed to spice things up a bit. So
Sounds like you, Teresa.
And then Bill gets back up, and we actually have affiliate awards that we give out at the bronze, silver, and gold awards for the different areas of our metrics that we measure, and we have a celebration there as well. So it's a great night.
So just to be clear, each of the 42 winners, you read a story about each of them and make sure that they're each honored individually, which I think is a really special way to do it.
Mm-hmm.
And Debbie, how many people have been nominated throughout the years? How many people have actually won?
Oh boy. We have, I would say, about 100 to 110 nominated each year. Mm-hmm. So over the past 7 years, do the math, that's 700 to 800 employees that have been nominated throughout the year. This is nominated either from coworkers, from family members. It could be, different ways. And for winners, I want to say we were I'm looking at you, like about 450 or so. I mean, you've been with us.
I had written down about at least 250
for the past 7 years. That sounds about right. There's about 40, between 30 to 40 a year. So that's about right, about 250 winners.
So for an organization our size, that's really a select number of people. So congratulations again to you guys. So Rocco and Teresa, I want to find out how your colleagues reacted when they found out that you had won the award. Did they treat you any differently, Rocco?
I wouldn't say they treated me any different, but I think that they were very proud for the recognition from someone on our team. I think the idea of being able to go in the building and people, being proud of the fact that I was nominated as one of their representatives, for the award, that was very nice. And and I guess I have to say that some of my teammates did have some joking to make about me winning, but for the most part I think it was a win for the team, which I'm really happy about.
I agree. Yeah. How about you, Teresa? Did your colleagues treat you any differently?
No, they just were congratulating me. I mean, everybody kept congratulating me all over the nursing home, the administration and everybody, and it was all the same, except for, we worked the same. It didn't change anything.
And I understand that the book that we create that has the stories of all the award winners in it, you brought it in and shared it with your residents?
I did.
Yeah.
Yeah, they liked it. They were happy to actually, the resident that I was in the picture with in the book, she now has a copy on her wall in her room, and she calls me I'm her adopted daughter, she said. She's cute.
Debbie, did you get any comments from family members who were there at the award ceremony?
I remember hearing from one of our award winners, she had her son there with her, and I remember her telling me that she came back to the table after receiving her award, and he said how proud he was of her, and it meant a lot to her considering he's a teenager. And coming from a teenage boy, she said it meant so much to hear those words, that he was so proud of her.
And Rocco, has winning this award changed your outlook on your job at all?
No, my perspective of the job is that that the unity of working together as a team is just getting better and deepening and branching out further, across the company and the affiliates. It's It's just I think it's a proud moment to be recognized, but I think the idea that the commitment that we have as a company towards the individuals and the that work for the affiliates that make up the team, it's very rewarding to be part of that.
That's great. And what about you, Teresa? Has your outlook on your job changed?
Not a lot, but I'm always trying to recognize something good in other people, and I'm stumped.
Well, you had talked, I know we had talked about this before, that you were saying that there were a lot of people that you work with who deserve recognition.
exactly.
And you just, that winning the award had made you want to pay it forward even more.
Yes.
Yeah. Well, congratulations again to both
Thank
of
you.
you. Thank you, Debbie. Thank you all for being here. And this has been InfoSource, a presentation of Berkshire Healthcare Systems.